Taking care of our health is important for us and for our families. There are some things that can affect our health that we may not know about until it gets bad, such as cancer. In our culture, people often only go to the doctor when they are sick. Most Americans go to the doctor for checkups when they are not sick, so that any problems that they cannot see or feel can be found early. Women who have regular checkups, such as mammograms for breast health and Pap tests for cervical health, are more likely to stay healthy. In the United States, breast cancer is the most common cancer for women and the most common cause of death. The risk of breast cancer increases as we get older, but there are things we can do to find it early on before it gets bad. Breast cancer screenings are called mammograms, and women should start getting them each year once they turn 40. Mammograms are X-ray images that look at what is inside of your breast to see if there are any abnormal lumps before you would be able to feel them with your hand. Getting a mammogram may feel embarrassing and uncomfortable, but it is important to get these screenings because all women are at risk for breast cancer. When you go in for your mammogram, make sure that you do not wear deodorant or powders on your chest or under your arms because these can cause spots to appear on the X-ray pictures. The entire procedure should take about 20 minutes to complete. The technician will give you a gown to wear and will ask you to take off your top, so it is a good idea to wear pants or a skirt so you do not have to take off all of your clothes. If a lump is found during your mammogram, your doctor may want you to come back for another mammogram or other testing to see if it is cancer. A suspicious finding may just be thick breast tissue or a harmless, non-cancerous lump, but it is important to make sure that it is non-cancerous in case you need to go get treatment. Cervical cancer is one of the most common cancers among women, but it is also the most preventable type of cancer. Your cervix is the opening to your uterus where babies grow. There are some things that may put you at increased risk of cervical cancer, such as having had a sexually transmitted disease, having sex at a young age even if married, having multiple sexual partners, smoking, not having regular Pap tests, and having been exposed to HPV. HPV is a type of virus that can cause cervical cancer. A virus is something very small that you cannot see with your eyes, but can cause illness and sometimes cancer. You can protect yourself and your daughters from HPV by getting vaccinated. Vaccines protect your body against viruses. Women and girls should get the HPV vaccine between 9 and 26 years old. Even if you are married, you should still get this vaccine. There are 3 shots for the HPV vaccine that you should get, and you need to get all 3 within 6 months to be fully protected. Just like mammograms screen for breast cancer, a Pap test screens for cervical cancer early on so that the uterus does not have to be removed. Even if you got the HPV vaccine, you should still get the Pap test every 1 to 3 years once you turn 21 or get married. You can get a Pap test in a health clinic like this one with a doctor or a midwife.
Hi, my name is Allison Hartwell. I'm one of the midwives with the UNT Midwifery Group. A midwife is a healthcare provider that takes care of women both in their pregnancy and also when you're not pregnant. Midwife means with woman, and we enjoy spending time with women in their visits, teaching them about their bodies and helping them to make good decisions, to take care of themselves and to be healthy. Here at the PCC, we do Pap smears, we do physical exams, we do blood work. We provide lots of different options to help you take care of yourself.
Hi, I'm Katie Hopkins. I'm one of the UNT nurse midwives. As midwives, we enjoy serving women from many different cultures, and when you come in for a visit, we're happy to arrange for a female interpreter to be here so that you're comfortable talking to us and asking us questions about your health care so we can better serve you.
So as midwives, we like to take care of you during your pregnancy and also between pregnancies, and we like to build a relationship with you and with your family so that we can take care of you as a whole person, not just your examination when you come in each year.
Hi, I'm Kathleen Donaldson. I'm a certified nurse midwife, and I'm here today to talk to you all a little bit about the Well Woman exam and a pap smear, which is a test that we'll do as part of your Well Woman exam. The pap test is just a part of the Well Woman exam, but it is typically a part that most women don't know as much about and are a little bit more curious. So I'm going to go into a little bit of detail about the specific part of that exam. What this test looks for is for certain cells on your cervix, which is the opening of the uterus, that will indicate to us that you have a virus called the HPV virus. So the first thing that I'll do is take my gloves, and we always wear gloves, and this is not just to protect us, but it's to protect you from other types of germs. This is a container that the specimen goes in. These are a few things that we use to get the sample or the cells from the cervix. And I want you to kind of see, this is what we see when we look at the vagina. So it's a nice little opening like this. This is called a speculum. This is a device that we use so that we can see your cervix at the end. The vagina is a closed object, and it doesn't really open up until we put something inside of it. So it makes a little sound like this. You can hear this. You might hear this little sound, and that. So we're going to show you how this goes. We'll use a little lubrication sometimes to put on there. Most of the time, you do not necessarily feel the speculum. What you usually will feel is pressure. If you feel pain, you need to be sure and let the provider know that you're having pain, because you should not have pain with this. The speculum itself goes into the vagina, and this is a point at which you may feel some pressure, and they usually will tell you you're going to feel a little pressure. We will open it up like this, slowly open. If you look inside the speculum, you'll see that we can now see the end of the speculum, which is where your cervix is. We then take the little swab, go inside, rotate this around on your cervix, remove it. The sample of the cells that we get from your cervix go inside of this container and sent to the laboratory for evaluation. You'll hear that sound again. Close it and remove the speculum. Hopefully you're not going to have any significant discomfort from this. It is very quick, but it gives us lots of really good information about your health care. This particular procedure, if all your pap smears are normal, should only need to be done every 3 to 5 years. And your provider will explain that to you after your results come back. Anyway, thank you very much.
You may think that it is better not to know the results of your pap test or mammogram, because if the results are abnormal, it could cause bad emotions. Early treatment can prevent long-term anxiety and stress about any problem. It is normal to feel afraid, angry, or sad about a negative outcome, but ignoring it and denying a problem is there will not make the abnormal results go away. Keeping good health is important for us and our families. Getting screened is a gift to ourselves and our family this year and many years to come. A healthy woman makes a healthy family.